what's going on, everybody? Welcome to Alone Together Pittsburgh. We've been streaming at you live since the pandemic hit in early March, but you may be surprised to see me because you're here to see the Allies Ball tonight. But we are having a Allies Ball takeover of Alone Together Pittsburgh. But if it's your first time, if you didn't know we were around, we've been streaming at you live since the beginning of the pandemic. It started back in March. We were doing about 3 or 4 days a week. I think we're around episode 92. We started the show as a way to keep a sense of community and keep things going and keep people aware of what everybody else has going on. But we are very excited tonight that the entire show and platform is going to be taken over and housing the Allies Ball. Because it is always one of the best parties of the year. But there are a couple of things that we do here on Alone Together Pittsburgh every night that we kind of have to keep things going until the takeover becomes official. We have a little thing here that we call the Engine House 25 Winery, EH25.com Jagoff poll. Now, it's not off-putting. It's not a derogatory thing. We use it as a term of endearment, right? It is a bracket poll of all things Pittsburgh, from people to places to food to words to phrases and everything in between. We've had over a couple hundred people in here, and we're getting down to the Sweet 16. So last night, when Allies CEO Sean DeYoung was on the show, we actually had a synergistic moment because we realized that who the overnight poll was going to be actually had last year's co-chair of the Allies Ball. Now I'm going to pass this over to the man in the booth, Dave Mansueto, who's going to be pulling switches tonight. He's going to tell us about the poll and how it shook out. Dave, take it away, Captain.
All right, ladies and gentlemen, our overnight poll. The timing was perfect, and we are ready to party. It was Billy Porter versus the Pittsburgh Pierogi Race. Billy Porter, the man that will take you out with just a glance, versus the Pittsburgh Pierogi Race. That's Salty Sal and something with prunes. And who was the winner in our Jagoff contest? Billy Porter with 91% of the vote. Pierogi Race, a pitiful 9%. How fitting Billy Porter destroys the Pierogi Race. That is the Jagoff overnight. And now, people, I can't wait to get groovy.
Well, Dave, it is almost time. It is almost time. Are you ready for this? So the Allies Ball is always one of the best parties of the year. My wife and I are big supporters of Allies. So I think it's a perfect, speaking of synergy from before, the fact that when COVID hit, it affected everybody, right, in different ways. So parties essentially got squashed as well. So the fact that the Allies Ball is still going to go on tonight, I already know what the lineup is. Other people are going to tell you about it. So you guys are in for a treat tonight. That's all I can tell you right now. Allies is a fantastic organization. You'll find out a little bit about that. But tonight is going to be to party. So before we make this crossover official, I think I should just get in the mood here, right? Because I'm not going to have to work very hard tonight. It's almost the night off for me. Dave, let's get ready. Before we turn this over, before we make this official, give me some time here, Dave. Let me. Well, folks, it's time to party. I'm going to sit back tonight. I'm going to sip my cocktail, pre-mixed at Tina's. I'm going to fix my bow tie because it's that kind of party, my Not Slam bow tie. I am ready to kick it and have a good time, and I'm going to be a rebel tonight. I'm going to kick back and party. You guys get Marty.
Hi, everyone. I've been cheated by you since I think you knew it. So I made up my mind it must come to an end. Look at me now, will I ever learn? I don't know how, but I suddenly lose control. There's a fire within my soul. Just one look and I can hear the bell ring. One more look and I forget everything. Whoa, whoa, Mamma Mia. Here I go again, Mama, look how much I miss you, Mamma Mia. Now I really know why I should not have let you go. Yes, I'm broken hearted, blue since the day we parted. Why did I ever let you go, Mamma Mia? Here I go again, Mama, I should not have let you go. I've been angry and sad since I think you knew it. So I made up my mind, it must come to an end. Look at me now, will I ever learn? I don't know how, but I suddenly lose control. There's a fire within my soul. Just one look and I can hear the bell ring. One more look and I forget everything. Whoa, whoa, Mamma Mia. Here I go again, Mama, I should not have let you go, Mamma Mia. Here I go again, Mama, I should not have let you go. Yes, I've been broken hearted, blue since the day we parted. Why did I ever let you go, Mamma Mia? Here I go again, why did I ever let you go? Hello, Pittsburgh! Good evening. That's Blake Allen on piano. I'm Marty Cummings, and I'm so excited to be with you. And welcome to the Revel Online Show.
Hey, how are ya?
Hi.
Hello, everybody looks amazing. Beautiful, beautiful. Thank you so much for joining us for the 2020 Allies Ball in support of Allies for Health and Well-Being. I'm Natalie Bensavanga, and our environment is much different than we thought it would be. You know, we are 6 months past our initial date for this event, though we've made some adjustments for your safety and ours due to COVID-19. We are more excited than ever to celebrate with you tonight. We have performances from Chris Weaver of NBC's The Voice and entertainer Honey Davenport coming up in a little bit, and we'll be discussing how allies and how all of us have grown and changed since the beginning of the pandemic. It's going to be such a great evening. I've already started having one of the Allies cocktails, if you can tell. And to start, I'd love to introduce my co-host first from Pittsburgh's One Hood Media. Cheers, Miracle Jones.
Hello, Natalie. It's a pleasure to be here this evening.
It's a pleasure to see you, and you look so beautiful.
Oh, you too. And I love your jacket.
Thank you. I went for the whole, I was trying to do the punk romance thing, but, you know, we'll see, but trying. And of course,
and punk.
yeah. And from New York City, we are bringing back Allies Ball favorite, Marty G. Cummings. You may remember their show-stopping performance from last year's event. How are you? Looking amazing.
Hi, Natalie. Hi, Miracle. I am so excited to be back with all of my Yinzers, my Pittsburgh friends. I wish that I was with you all in person so we can go down there to Eaton Park after, but for now, we will do this socially distanced, and next year, we can all have Smiler's cookies together.
I actually love that idea, and I hope we honestly get to do that next year. That would be amazing. So the pandemic has made it difficult for us to connect with one another in ways that we are used to. So I thought it'd be nice, you know, if we kicked off the evening by getting to know each other a little bit better. So Miracle, of course, you do incredible work with One Hood Media, and you've been very active in the social justice work here in Pittsburgh. Would you like to share a little bit about what you've been up to?
Yeah, so One Hood Media, we are a collective of social justice artists, so we call ourselves artivists. And since the pandemic, we've been handing out PPE. We have shows that we run on our Facebook about what Black Pittsburgh needs to know about COVID, Ask a Black Doctor, and we have various like digital streaming platforms. So we have spoken word contests, we have concerts online. And so we try to engage and educate and entertain people at the same time. So we're pretty busy over here at One Hood. But like, I can't say we're as busy as Marty, because Marty, you're running for city council in New York, right?
Yeah, well, first, Miracle, I just want to say the work that you do with One Hood is so amazing. And I think it's incredible, that you are using your voice to be of service to the Pittsburgh community. So round of applause for Miracle, everyone at home. Round of applause. Awesome. Yes. And thank you so much. I'm so honored to be back. I love Pittsburgh so much, and I love the Allies Ball. And yeah, I am running for city council in New York. It is a unusual time to be running for office, but we need true progressive voices in all levels of government. Not only am I a drag artist, obviously, but I'm the first non-binary candidate in the state of New York. So I'm super excited to be doing this, and I can't wait to win and to pass some progressive legislation in my city. And Natalie, you are a very familiar face with the Pittsburgh folks. You've been taking local journalism in a new, innovative direction. Can you tell us a little bit about that?
Yeah, I'd love to. And first, I just want to say that I'm so honored, seriously, to be with both of you tonight. I really am inspired by both of the work that you guys do. So thank you so much for letting me share tonight with both of you. This is such an honor for me. And since leaving the Post-Gazette in April, I've really been able to just sort of branch out and try new things and be able to really ground my work in that of the communities around me, and share stories that sometimes are overlooked and perspectives that aren't always heard, but I believe need to be centered and amplified. So it's just such an honor to be a part of something as positive and necessary as Allies Ball tonight. So thank you guys for having me. So now that we've all gotten to know each other a little bit better, here's what you can expect from the rest of the show. So first of all, we want to thank everyone who made this evening possible, particularly event architect Tommy Conroy and 412 Main. It's honestly always exciting to see Tommy's visions come to fruition. And we'd like to also thank All Occasions Party Rental, Giant Eagle, UPMC and UPMC Health Plan, Big Catering, and the Gateway Health Plan. And we also want to thank the sponsors currently listed on your screen. Without the generosity of supporters, we literally could not put on this event. And as a reminder, the Allies Ball helps to support the work Allies does to help those living with and at risk of HIV, hepatitis C, and STIs.
Thank you so much, Natalie. And if there's one thing we've learned over the past 6 months, it's the importance of all of us working together and how our individual actions can have a lasting impact on our community. The pandemic has highlighted the gaps in our social support systems here in the US, and health and human service organizations like Allies have to fill those gaps. Allies services are essential and have helped sustain hundreds of people during this pandemic. Tonight, all of you tuning in, have the opportunity to make a real difference in the lives of Allies patients and clients. All you got to do is very simple. I know you're all on your phones all the time. You're swiping through the gram, swiping through Twitter. So use this opportunity to use those phones for something a little more important. All you need to do is text Allies Ball, that's all one word, to 243-725. That's Allies Ball, and the number is 243-725. We are hoping to raise $5,000 this evening, and I know we can do it. We are counting on you to help us achieve this goal. Your donation, oh no, I lost my spot in the script. Oh, it's live. We're live. Okay, so people are still being diagnosed with HIV, hepatitis C, and STIs, and your donation can help keep our testing facilities and services free. Your donation can also put groceries in our clients' cupboards, and your support is vital in giving our clients and patients access to quality, comprehensive medical care and mental health support. And Miracle, I know that your work overlaps quite a bit with the community that Allies serves. So what do you see as the biggest obstacle preventing people from getting the care that they need, particularly when it comes to HIV and STIs?
I think the biggest obstacle when it comes to treating people with STIs and HIV outside of the stigma is the access to health, right? So we know for a lot of us, especially those of us in the African American community, from a history of violence and neglect that has led to gentrification, there is a lack of financial resources that will allow people to have access to healthcare. And so when people have to make a decision whether they're going to eat or they're going to pay a medical bill, sometimes people's health has to take a back burner. And so it's one of the great things about Allies Health is they provide free resources for the community, and resources at a sliding scale and are low cost that allow people to get access to health. We know that this pandemic has revealed a lot of us have already known, that people who are Black, people who are queer, people who are trans live life at the margins and are often not at these tables where policy decisions are being made. And so one of the reasons that One Hood got really involved in COVID coverage is because we realized that nobody was talking about race. And because nobody was talking about race, we realized that that community wasn't being talked about and catered to and educated about COVID-19. And then we went to talk about people who are Black and queer, Black and trans, Black and disabled. And so that is what the biggest barrier is just the affordability and access of healthcare costs. And I feel like being in New York, you've probably seen the same things, Marty. So I think it's a really great program that Allies for Public Health is really doing here in the city of Pittsburgh and in Allegheny County. So,
yeah, I think that's so wonderful, the work that Allies is doing and the work that you're doing. Obviously, there was a great need for so many of these services for a long time, and the pandemic has exacerbated all of these issues. Housing, justice for all. We need to ensure that we are providing affordable, sustainable, livable housing for everyone, providing services for people experiencing homelessness, making sure that people who need medical attention are given medical attention for free. Medicare for all, okay, hashtag get up on that. And we need to be providing mental health services for people. That's something that I think our country as a whole overlooks so much. Mental health is so crucial and so critical. And so having those services is imperative. And food insecurity is exacerbated at alarming rates now. I know in New York it is. I was just volunteering at a food pantry this morning, and the line gets longer and longer and longer every single week, the longer this crisis goes on. And it particularly impacts our Black and brown communities, our immigrant communities, and communities that the system is designed to disenfranchise, which is why we need to abolish the system and rebuild it to be equitable for all people, not just rich, straight white men. Enough of that bullshit. Not to throw the tea on the tea, but that's how it is. Okay? So I am grateful for organizations like Allies who are doing the work and not just talking the talk, but walking the walk. And Miracle, I love you, girl. And I love your necklace and your fears. And I can't wait to be there next year and kikiing with you down in Oakland or where I don't know the neighborhoods there. But Oakland sounds great. I remember that one.
Oakland is fun. I wish I was in New York so I could vote for you because you're so on point about what's going on. And so Allies' vision is to provide integrated medical care and supportive services to all individuals in a setting that's free of stigma and discrimination. And one way they're doing this is through Allies Clinic. So next, we're going to speak to Allies Clinic Director Melissa Curry and Allies Physician Assistant Kiki Kauai. So welcome both of you. And first of all, can you tell me a little bit about yourselves and what it is that you do at Allies?
So yes, hi Miracle. My name is Melissa Curry and I'm the Director of Clinical Services at Allies for Health and Wellbeing. I'm a mother, a wife, a registered nurse, and I'm also a student at Carlow University pursuing my MBA in healthcare. So my role at Allies is to oversee the day-to-day operations and the workflow in the clinic. And I supervise the providers and the clinical support staff at Allies, and I report directly to the CEO.
Wow, so that's like a lot of different labels. And Melissa, COVID-19 has made people more aware, especially more than ever, about the disparities that exist in our healthcare system. And what are some of the disparities that you see most often right now at your Allies clinic?
So yeah, so these disparities are not a new onset, obviously, as you were talking about earlier, and they've been evident even before COVID-19. But what COVID has done is shined a light or a magnifying glass, if you will, on the disparities that have been here for decades and even centuries to some extent. And so, a lot of studies have shown that the communities that have the greatest health disparities are the Black and Brown community, the LGBTQIA plus community, people living in rural areas, and low income communities. And these are all communities that we serve here at Allies.
So, can you speak on that a little more? How is Allies working to negate and combat these disparities?
So, first off, we recognize the disparities, and so we continue to strategize on methods to reach the communities at hand. And so, in order to address these disparities, we work we work through what I like to call the 4 Ps, and that's practice, position, passion, and purpose. So, with practice, we practice through providing day-to-day high-quality care for our patients, and we provide extensive training and education to our providers and our clinical support staff in order to address the medical, social, behavioral health, and emotional needs of our patients. And then we position ourselves to be able to reach the communities that are underserved, whether it be through telemedicine, which we began utilizing this year for those that have difficulty accessing healthcare. So we have social services and grant programs for those that have difficulty affording healthcare services. And so we're also able to tailor our services around the patient's needs, whether it be primary care, gender affirming care like HRT, gynecological services, family planning services, STI treatment and testing, HIV and Hep C treatment, and HIV prevention services like PrEP, as well as our pharmacy program, because obviously everyone manages their health differently and requires a different extent of healthcare. And so we understand that at Allies. And so we are ready to listen to our patients and meet them where they are. And so the passion portion of the 4 Ps is what inspires us to serve and go above and beyond to provide the highest quality of care possible for our patients and our clients. And then our purpose is that's what drives us to keep breaking down these barriers that are causing all these health disparities in our communities that we serve, so that the end result is that no patient is left behind.
That's amazing. And Kiki, turning it over to you. I love your outfit, by the way.
Thank you.
We almost were twinning, but then I was like, let me do the pink. But so over the past 6 months, Pennsylvania Secretary of Public Health, Dr. Rachel Levine, has been a prominent figure in the public eye, as she has faced serious scrutiny, not just because she's been helping to make crucial decisions regarding the state's response to COVID-19, but also because she's a transgender woman. Mm-hmm. And in Pittsburgh and across the nation, Black trans activists have been calling attention to the lack of resources that are available to the community, and many people may be unaware that Allies is a local resource for the trans community. Kiki, can you tell us some of the services that Allies offers for the community?
Yeah, absolutely. I think Melissa kind of hit the nail on the head, right? I think we offer so many amazing things. And just to kind of back up for a second, in regards to like Secretary Dr. Rachel Levine, can we just give somebody props for occupying space, for being a proud transgender female woman in this space, occupying it so we can see ourselves in that space, right? But in general, what we do for our patients of trans experience, people who identify as non-binary, gender expansive, gender non-conforming, we do medical care, right? Whether that is for gender affirming care from medical HRT, whether that is tapping into resources, whether that is helping people engage into mental health services. I think that Melissa really hit the nail on the head again with that, those 4 Ps. I think at the end of the day, my biggest job as a medical provider is to advocate for our patients. There aren't enough resources, but the resources we do have, we can help you get tapped into, truly. So if you're ever curious, hit us up, social media, let us know. We do a lot for our community, truly.
And another big barrier is like people being disrespected and misgendered. Can you talk about how welcoming the staff is at Allies?
Yeah, absolutely. We actually just had a training on this that I help lead. It's definitely something that's important. You want to walk through the door and again, see yourself in the surrounding, right? Whether that is rainbow stickers or affirming bathroom signs that say gender inclusive bathrooms, or bathrooms that have a urinal or without, right? But you also want to interact with people through the entire experience, whether it is the people that you're checking in with, the medical assistant, or whoever's doing your intake, the medical providers and checking out. You want everybody to use gender inclusive language, leading with the respectful and the with respect and dignity, that foot forward, appreciating and respecting pronouns, using those. I think that these things are all important because we've all kind of hit on, there are so many things that are barriers for people's medical care. And I think right now, especially during COVID era, it's making things worse, not better, right? So we're always improving, but it's definitely something that people can see themselves in that space. They're being respected, they're being treated with dignity.
That is amazing. I'm glad Allies is doing the great work that is needed so much in our community. So thank you so much, Melissa and Kiki, for sharing some more about the things that have been going on at the Allies Clinic. And don't forget, you can support the work that Melissa and Kiki do. The text to give info is running across the bottom of your screen. So please get out your phone and donate and support. Natalie, turning it over to you.
Thank you.
Thank you. Bye, everyone.
Thank you so much, Miracle. That was such an incredible conversation. I always learn so much when I'm listening to you and the wonderful people that you had to chat with. And now we're doing a little 5 minutes with. Normally I do these for Alone Together Pittsburgh, but of course, since we're taking over with Allies tonight, we thought, why the heck, let's just do it. So here we are, 5 minutes with, and I'm going to be chatting with the CEO of Allies, Shonda Young, and board president, Dr. Michael Madden. I wish I had like an applause track. How are you?
Great, great.
Wonderful. It's so good to see you.
Thank you.
Yes, I like this. Is this an ascot? Is that what we're calling it?
Cravat.
Oh, cravat. Okay.
Romantic pun.
I like it. So I think we're waiting also on Sean as well, because I think we're going to be, oh, perfect timing. And he came in a tuxedo, which I so appreciate.
How are you, Natalie?
I'm very well. How are you doing tonight?
I am doing exceedingly well. Thank you.
This has been.
It's so great to see you.
It's so great to see you. And I was just going to say, this has been so amazing. This whole ball in a box thing. I'm really into it. I'm actually enjoying one of the flowers that Tommy dropped off in my hair. So I'm getting into the spirit of things. But, you know.
I was going to try that too. It just didn't work for me.
You look amazing. You don't need any other accessories. But, you know, this has been quite a trying year for everyone, for countless organizations. So I think being able to have an event like this to bring the community together is more important than ever. And Sean, especially with everything going on with COVID, how has the response been from Allies, and what have you had to do to adapt?
Oh, it's been a challenge, obviously when things shut down, but our work hasn't gone away. We're still, fighting this disease and other STIs. And that's been the biggest challenge through all of this pandemic so far is, we can't get out and test like we were able to do prior to the pandemic. So, we test on site now and it's by appointment only, but we did a lot of community-based testing prior to the pandemic. And we can't do that now. We're hoping in the coming months, we're going to be able to start reopening that. We are doing more testing on site now at Allies, and we're testing 6 days a week again, by appointment, Monday through Friday, but on Wednesday evenings and Sundays, we're doing walk-in. But we did get a testing vehicle that we are outfitting that hopefully in the next couple of weeks, we'll be able to get out into communities to do some outreach testing. So that's been one of the biggest hits for us.
Yeah, I can imagine this time has been so trying for everyone. And not only have we had a pandemic, but we've also had an economic fallout that has accompanied it, along with really a second wave civil rights movement wrapped up as the Black Lives Matter movement. And Dr. Madden, can you speak to how the message of Allies is perhaps pivoting towards more of an anti-racism model to reflect what is going on locally as well as nationally when it comes to Black Lives Matter and centering marginalized groups of people?
Yeah, Natalie, I'd love to do that because our staff and everybody affiliated with Allies has done a great job in responding to the pandemic and Black Lives Matter. You know, since we transitioned from Pittsburgh AIDS Task Force to Allies for Health and Wellbeing by opening our healthcare clinic just 4 years ago in East Liberty, our vision has been to offer integrated healthcare services and supportive human services that are free of stigma and discrimination. We created this space of equality and non-discrimination. That discrimination is due to sexual orientation or gender identity, race, ethnicity. It's really built into the work that the staff at Allies does. The COVID-19 pandemic really brought the healthcare disparities faced by the Black community to the forefront. And when the protests started after the death of George Floyd, it was really a wake-up call. We all need to do more. And we're so excited to report that since 2016, the percent of our staff who are people of color has increased from 21 to 31%. And that now 30% of our health center patients are Black. And as further evidence that Black Lives Matters to us, Black Lives Matter to us, especially those living with HIV, we're really proud to report that 56% of our care management clients, the ones who have HIV, are people that are Black. And we're doing this work quietly, but we really need to be louder about it and to amplify other people's voices. It advances our own vision to lend our voices to the platform of this movement. And that's why it's so important to Allies.
Amen to that.
Yeah, I think it's really important that you're really taking it in and making structural changes that are reflecting the work that you want to do in the community. That's beautiful. So before we wrap up, I just want to know for 2021, for moving into the new year, what is your hope for Pittsburgh and for Allies?
Well, for Allies, we are hoping for a lot of things. We're hoping for growth. We're hoping for more outreach to reach more people that are living with HIV that aren't in care. We're hoping to reach more people that are, need our outreach services for PrEP and testing, that we can get out into the rural communities. So we have big plans. So, we're, and Dr. Madden, add whatever you want to add onto that.
Yeah, more growth. But the other thing, it's a party tonight. And one thing we really need to celebrate is that this is now the 5th anniversary of Sean being our CEO. So that's
cheers! I'll raise a glass to that.
Exactly.
That touches my heart. Thank you, Dr. Med. Yes, this is my 5th anniversary, and it's been such an amazing experience being part of this organization and the amazing people that I get to work with, both staff and board. It's so awesome, and the community that we are embracing. Our clients, consumers, all of them have been so amazing, and we just want to do so much more for them. But I'm glad to be a part of this organization.
The staff at Allies adjusted to the pandemic and all these challenges. They didn't miss a beat. Kept getting care to people, providing services to people. It's been really gratifying as a board president and our whole board to see how they really stepped up in this difficult time.
Well, I appreciate both of you so much for the great work that you're doing in the community to raise awareness for so many issues and to be so supportive of so many types of people. So cheers to both of you, and thank you so much for spending 5 minutes with me.
Well, and I'm going to raise my glass. And Natalie, thank you for always supporting us so strongly. I appreciate you so much. Thank you so much.
I'm honored to be a part of it. Thank you. All right, let's see. Where are we with our donations? How's everybody doing? A little check-in. Everybody know what? Yeah. Oh, here we go. Okay.
All right. How much have we raised?
I know we can do more. I know we can do more.
Oh my goodness, we can do so much more. So everyone make sure at home that you are texting to get your donation in.
That's
We
right.
actually,
And I'd seen that some of the donation levels do different things. And I think there was one in a $50 donation, which actually takes care of somebody's transportation getting to a therapy appointment. So I think that would be, just thinking about where your money's going and how much you're actually able to do for somebody is really gratifying, I think, for this experience.
Every dollar makes a difference. And
Yes.
I think it's important to recognize a lot of people are going through financial hardships right now because of income insecurity or whatever they're going through because of the pandemic. So even if you can only donate $1 or $5 or $10, that is okay. Every contribution really does make a difference. So please, thank you, Megan and Melanie and all the donors who have been out there. But now, one of the moments that we've all been waiting for. Oh my gosh. It is time for the presentation of the Carrie Stoner Award.
Hello.
Hi, how are you?
Doing well. How are you?
Good. I'm so excited to have you here because each year the Carrie Stoner Award is given to a person or an organization that has shown extraordinary commitment and dedication to allies and to the HIV community. And this year, that award goes to Dr. Martin Seltman. Hello, Dr. Seltman. How are you? Congratulations on your award.
Thank you so much. I'm really honored.
It's so wonderful to have you here. I love your bow tie. You look amazing. And I understand that you have a couple of specific guests in mind for this part of the show. Can you introduce them for us?
I sure can. Well, Jim Huggins is the first, and I know he's here. I've known Jim for a long time, and I thank him for really getting me involved with this work back when I was a first-year resident. And Cindy Klemansky is one of the co-founders of the Shepherd Wellness community, another organization that worked with this HIV community. And I didn't mention that Jim, along with Randy Forrester, were the co-founders of PERSA. And I think these three organizations, as the original organizations in Pittsburgh that supported people living with HIV.
Wonderful. Well, thank you so much, Dr. Huggins, for joining us. And congratulations again, Dr. Seltman. And thank you for your incredible work that you have been doing for the Pittsburgh community and the HIV community out there. Dr. Huggins, I want to ask you, what are some of your favorite memories of working with Dr. Seltman? And what are some ways that Dr. Seltman has impacted your work?
I first met Marty in the, I think, middle 70s. And to put this in historical context, during that time, I was open and out, but there were very few of us within our community that could afford to be open and out. They were afraid to lose their jobs. They were afraid they would lose their family. They were afraid to actually be honest with their physicians. So most of our clients at PERSA would not tell their physicians that they were LGBTQIA. And so physicians couldn't give really good medical care. Plus they had bad treatment from physicians in the past. So when I first met Marty, I'm a gay man. I've been out for a long time. I have a sixth sense of when homophobia is present. And I know that sometimes when I walked into a room full of mostly men, I can make those people rather uncomfortable because of my very presence, because of their own homophobia. And my reason for saying that is that I met this amazing, marvelous man. None of that was present. He was immediately accepting, immediately reinforcing, immediately caring and kind. And so I did a lecture with the residents, and he came up and said, I want to get involved. And so I thought we had won the lottery. because we were now able to say to our clients, here's a guy, here's a physician that will listen to you and respect you. And then not only did he do that, but transgender folk couldn't go anywhere for good care. And Marty educated himself and became the primary physician in the Pittsburgh area to give transgender care. And also he was on our board at PERSAT. He was the president. That's how involved he got in our community. He's actually good friends with my friends. So I can't say enough wonderful things about him, but just as an aside, I was actually his patient, which is how I knew what a wonderful doctor was. And quite frankly, he was stunningly good looking. And so he was my idea of a gay man's dream, to have a kind and caring and loving physician. And he was really not hard on the eyes, if you know what I'm saying.
Well, that is so wonderful, Dr. Huggins. Thank you for sharing that. And I am so grateful to both of you for the incredible work you've done for the community and for providing services at a time when many doctors wouldn't provide those services. And even today, a lot of doctors probably wouldn't provide these crucial services. So it's so important to have leaders like both of you. So thank you, Dr. Huggins, and congratulations, Dr. Seltman, on your award.
Congratulations, Marty. Congratulations, Marty.
I didn't get to show you the award. Wait a second.
Oh, yes, show us the award.
This
that's wonderful.
All right.
Which my grandkids think is like a magic wand. Harry Potter.
Well, we need a magic wand right now for 2020, and I know that that Cindy wanted to be with us tonight, but there's a couple some internet connection issues. So
can I just say one more thing, because Cindy isn't here? Dr. Selman was always also one of the first people that we could refer people with HIV and AIDS to in our community. And we did healing weekends where we would bring people in, people with HIV and their significant others, and we would spend the weekend with them and giving them workshops on health and well-being. And Dr. Seltman was our medical personnel during that time through all of the healing weekends. So that's another aspect of him that hasn't gotten said yet.
So, well, thank you so much. And Dr. Seltman, it's an honor to share a name with you. I love meeting a fellow Marty. Thank you again for taking the time to join us this evening, and congratulations on your 2020 Carrie Stoner Award. So everyone at home, round of applause for our Carrie Stoner Award winner this evening. Thank you. Have a good night, guys. Thank you so much.
Thank you. Bye, Marty.
That was wonderful. And it's so incredible to hear from these pioneers and leaders who have really paved the way for the work that's being done today. Hello, Miracle and Natalie. Woo! I think we should check to see what our fundraising is so far.
I agree. And also that conversation was amazing.
Oh my gosh, I love the beauty of their friendship. It's just, whoa, we just jumped a lot.
That's amazing. Wow.
Thank you, Judith and Robin and David, for contributing.
That is fabulous. Look at that. Incredible.
So this means we are almost halfway to our goal. We are so close.
I love it.
So keep sharing, keep texting, tell your friends, your family members, share. Like when you donate, you're getting access to free health screens, so people who otherwise couldn't afford medical care. You're also supporting the food pantry, so people who are going without food will have access for food for a week. So please keep donating and sharing. Share.
Everybody who's watching, text 5 friends. Text 5 friends and tell them. So this we're gonna do the text banking.
I love it.
Marathon. Okay. This is what we're gonna do. Okay, we're gonna break it down. Okay, Miracle and Natalie, we are gonna have everybody watching, text 5 friends to do the following things. Tell everybody you know to fill out the census. Tell everybody you know to register to vote. And tell everybody you know, the 5 friends you're contacting, to donate $10 or $20 or $100 or $500, whatever they can afford, to the Allies Pittsburgh organization. So these are great things to do. Oh, we just jumped some more money there. This is
this is fun. I'm actually getting like overheated because this is like exciting.
This is great. Okay,
I feel like we're in one of those like telethons or something.
I feel like we're like the Price is Right or something. Like, it's so exciting.
I know. I'm like, it's too much. It's good. It's good. No, we do. We really appreciate everybody. And I think we have a couple of new donations here from Aaron and David and, Anonymous. Whoever you may be. We love a secret admirer of Allies. That's wonderful.
So, we are so close to hitting our goal. So everybody text those 5 friends. Text those 5 friends.
I love it. And it is just about time for some music. But first, if you haven't, I'm just going to reiterate it again, Marty. Okay, so text Allies Ball to 243-725. Like you said, for $10, $20, whatever you can do to help support Allies for health and well-being. And we just want to thank everyone. Thank you to Patrick, to Dave, and Pete, and Alone Together Pittsburgh for letting us take over this show. Honestly, I've had such a good time with you both tonight. So I'm so glad that we got to do this. And I'm one of your hosts, Natalie Bensavanga.
Wait, hold on. I'm gonna text it right now and see what happens. Okay, okay, it's 2. This is how simple it is. Okay, 2 4 3 7 2 5. Okay, and I'm gonna type in Allies Ball.
Yes.
Okay.
I'm doing it with you.
Typed it in, and let's see.
Okay. I'm with you on this.
Okay, it says thank you for your support. Click the link to donate. Blake, do you have a wallet? I'm calling my husband. Do you have a wallet? Where are you?
I love it.
I'm gonna give. Okay, here we go. We are. See, this is simple.
4 3 7 2 5. Let's do it.
See how easy this is?
We're all here. We're all doing it together.
That's right.
Who's gonna do it first? Oh wait. Okay.
I mean, I'm very competitive, Miracle. So
wait, I want to get mine in. What host can do this the fastest? Okay, what is my zip code? There we go.
I feel like Marty may have gotten a head start though, just in case.
I know. And now, okay, and then you just type in all of your important information.
You got to verify, make sure it's not fraud, make sure it's you.
That's right. And
my husband's putting in our card number. See, this worked. We got like $200 just now. Thank you, Chris. Thank you, Nicholas. Thank you, Brian. What are those old telethons? The Jerry Lewis is that what they were called?
Yeah, they were like those old. Those like I feel like we would be really good at this because we're just we can keep this going. We can do this all night. I think the 3 of us just
reminds me of we just jumped up.
What is it?
Oh, it just went through. Bam, bam, bam.
Ooh. So we really do have some good entertainment coming up. So keep sending in your donations and keep it all going. But I just want to thank you guys again for doing this and being a part of Allies Ball. This really was so much fun. And once again, I'm so inspired by you both. So cheers to you both. And thanks for sharing the space with me tonight. This was awesome.
Cheers.
Yeah.
Thank you, Natalie, and thank you, Miracle, and thank you so much, everybody, for tuning in. The party is not done. We have some all-star performances coming up. 2 of the artists are very dear friends of mine who I love very much, and I'm so honored to introduce our first artist from NBC's The Voice, the one and only Chris Weaver.
Hi. All right. Well, listen, guys, here we go. So this is me. I want you guys to give. And thank you, guys. Thank you, the Ally Ball, for having me. And I hope you enjoy this. I am not a stranger to the dark. Hide away, they say. We don't want your broken parts. Learn to be ashamed of all my scars. Run away, they say, no one will love you as you are, but won't let them break me down to dust. I know that there's a place for us, for we are glorious. When the sharpest words want to cut me down, gonna send a flood, gonna drown them out. I am brave, I am bruised, I am who I'm meant to be. This is me. Look out, 'cause here I come. And I'm marching on to the beat I drum. I'm not scared to be seen. I make no apologies. This is me. Oh, 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 oh. Another round of bullets hits my skin. Fire away, 'cause today we won't let the shame sink in. We are bursting through the barricades, reaching for the stars. Yeah, that's just who we are. Won't let them break me down to dust. I know that there's a place for us. Oh, we're glorious. When the sharpest words wanna cut me down, gonna send a flood to drown them out. Oh, this is me. Look out, 'cause here I come. And I'm marching on to the beat of drum. Oh, this is me. Hey, this is me. Oh, 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 oh. There's nothing I'm not worthy of. Hey, the sharpest words wanna cut me down. Gonna send a flood, gonna drown them out. This is brave, this is bruised, this is who I'm meant to be. This is me. Look out, 'cause here I come. I am marching on. Oh, this is me. And I know that I deserve your love. There's nothing I'm not worthy of. This is me. Woo. Thank you. So it's such a pleasure to be with you guys tonight. This is awesome. It's weird, but it's awesome. This live streaming, but I'm so glad to be a part of this event. So thank you to everybody for tuning in. Remember to give, and let's make some changes. All right. So we're gonna do things a little differently here. Now, listen, also don't forget to tune in to Chris Weaver Performing Live every Wednesday on Facebook, YouTube, and some other streaming platforms, who knows. But every Wednesday at 8:30. All right, here we go. I'm going to get out of here. I got one more song for you guys. It's called 21st Century Live. Hey! Hey! Yeah! When I was a little boy, living in the last century, thought about living in the future, and it occurred to me. I turned around, the future was now, the future was all around me. Nothing like a had imagined it was totally confounded. Yeah, 21st century life, I got swept away. I got 21,000 things that I gotta do today. 21st century life. Well, what can I say? Yeah. This new world's got me feeling so dirty. Think I need to get down and pray. Well, I turn on the TV just in time enough to hear what the Pope says. The Pope says. And in just a few tiny little words later, somebody wants the man dead. Ah, yeah. What about famine and disease? When they say it's too bad, but I'm never alone. It's not just a phone, it's the stereo. Hey, 21st century life, I got swept away. I got 21,000 things that I gotta do today. 21st century life. What can I say? This new world got me feeling so dirty. Think I need to get down and pray. Hey. 21, 21, 21, yeah. 21, 21. Now I'm not a little boy, I'm in the 21st century. Well, you might think we've come a really long way, but there's still no equality. I watch the news on my computer screen, talk about buying my weed out of a vending machine. You tell me I'm free, well how can I be when you're always watching me on the CCTV? 21st century life, what can I say? Yeah. 21,000 things that I gotta do today. 21st century life, what can I say? This new world got me feeling so dirty. Think I need to get down and pray. Hey, yeah. 21, 21, 21. Yeah. 21, 20, 21. Yeah, 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 yeah. Yeah, oh, oh, yeah. 21st century life. Yeah. Thank you guys. Listen, you have a great night. Enjoy the. Listen, have fun tonight. And this is great. Thank you again. Thank you, thank you, thank you. My name is Chris Weaver. Find me on Instagram, Facebook, and all that good stuff. Thank you guys.
Amazing.
Oh, that was so great.
Bye,
And
I
we
love
raised
you.
out. Hey,
We love your sets.
Thank you.
I was like, we are glorious. Well, I was like, I couldn't hit the note, but I was there with you in spirit.
Yes. It was good.
Listen, I was trying to hit those notes. It was
Chris and I used to host a drag competition together back in the day, so it's good to see you again.
Listen, you too. You look great, baby.
Well, we got the ring light. Okay, honey, it's a solid light today.
Yes, ma'am. I just got a couple of lamps here.
Blessings. This is entertainment in the new age. I love you. We have raised $3,500. That is almost $1,000 more than when we last checked in with you. So during this next number, we have a goal, and we are going to reach this goal. We are going to need to raise $500 in this next number to bring us to $4,000. Can we do it? Yes, we can. Can we do it? Yes, we can.
Yes,
so let's get on the good foot. So John, Jim, and Scott, thank you for your contributions. We are so grateful. Now text 5 friends and tell them to contribute as well, because we need to raise $500 during our next performance. Who is our next performer?
I think Bjorn, which is going to be pretty amazing. I got to hear him in the tech rehearsal, so I'm really excited about it.
Here we go.
Hello. Hey, how is everyone? Hi. Hey, so we got a little bit of time here to raise $500 more. I'm super excited. I got one song to perform, and just want to say hello and thank you to everyone. So $500 more. Let's go. My name is Bjorn. What? I gotta come back here to my other camera and my very special DJ Classic iPod. So let's kick it off. Whoa. Hold on a second. Oh my god. Oh my gosh. DJ Classic iPod screwing up. That boy loves rock and roll. AC/DC makes him lose control. He's a bad boy, a real sad boy. That girl loves Britney Spears. More connected through her tragic years. She's a flawed queen, a real human being. There's a diner in my mind. It's alright to come inside. You don't need to find a seat. This booth is big enough to fit the rest of us. We'll just slide down. Japanese girls walk through the door. Apocalypse night, swallow it whole. There's an end in sight. There's a warning light. My pedal, leave if you'd like. I wanna kiss you in the punishing lights. It's getting late. We don't have to stay. Those dark gardens, this yellow room, fruit fly eyeballs, the catacomb tomb. We're past kicking in. We can get through this. That boy loves rock and roll. AC/DC makes him lose control. He's a bad boy, a real sad boy. That boy loves rock and roll. That boy loves rock and roll. That boy loves rock and roll. Bad boy. Thank you so much.
I'm just going to applaud for everybody. It was so good.
So
Is there
good.
more? Yes, there's more. Maybe? Or are we just getting a little backstage preview
I just
here?
a little
Okay,
backstage
that was
peeky
fun.
peeky.
I was not familiar with Bjorn, and now I feel like I'm a big fan. That was amazing. Did anyone else feel moved by that? I was like into it. It's exciting.
Yeah, I saw the press rehearsal and I was like, wait, who is this?
I know.
It was a free concert.
I know. Oh, and look, we are getting so close to this goal, you guys. I mean, this is
We are so close, and we have just a few more performances left, so we can raise this money.
Oh yeah, this is going to happen.
I feel very good about this. So thank you everybody who has contributed. Please tell your friends and please contribute. And I am so excited for our next performer. They've been a dear friend of mine for many, many, many years. I love her so much. Her activism, her voice, her advocacy is so important. And I'm grateful for everything that she does for the community. Everyone at home, put your hands together for the one and only Miss Honey Davenport.
Yeah.
Hi, y'all. It's such an honor to be here and perform for y'all tonight. Here are a couple of my hits. Let's go. Now I don't give a damn if you hold somebody's hand as long as you worship me. And I don't give a hoot if you find that fella cute. I know you're my devotee. So you can keep your flowers, keep your emotion, shower me with praise and devotion. Get some on the side, honey, I can let it slide as long as you worship me. Here at my ivory tower, tremble before my power. Every waking hour, worship me. So go out with the boys, make some trouble, make some noise. Oh, I want you to feel so free. But oh, when I get home and I get you all alone, I expect you to bend the knee and swear you serve no other gods before me. Kiss me, beg me, love and adore me. I don't give a damn if you got another man, as long as you worship me. Bow at my holy temple, make me feel transcendental. Build me a golden idol. Pray till you're suicidal. Worship me. This is the point where you donate. I'm gonna help us get to our goals today. I need y'all to donate right now. So you can keep your flowers, keep your emotion, shower me with praise and devotion. Get some on the side, honey, I can let it slide as long as you worship me. Worship me, no one else above me. Here at my ivory tower, tremble before my power. Give me your wildflower. Every waking hour, worship me. All right, y'all, I got one more song for y'all just because I want to make sure that y'all donate so much. It is such an honor and a privilege to perform for y'all tonight. I'm so thankful for this opportunity, and I'm especially thankful for my good sister, Martigo Cummins, who invited me along on this ride. This next song is probably the most important song to me that I've ever written. It is where my art has really met my activism. And today, I'd like y'all to let your money meet your activism and donate some while I sing it. bitch. Yeah, slay, work, bitch. Breathe on this track, they all freeze at my back. I like trees cause I'm stressed. Cannot eat, cannot rest, no need to confess. Cause this is not a test. Another one of us just took a bullet in his breast. Oceans on my cheek, ball and chain on my feet. Every hood full of those who just needed a degree. Screams in my soul, but I be's what I'm told. And I'm wishing they love me the way they love their gold. Love me. Love me like I'm made like you. Just love me. That's all I ever wanted from you. Cause I slay just like them, God hears me pray just like them. Tell me what we see today where she gets paid just like him. Oceans on my cheek, ball and chain on my feet. Every hood full of those who just needed a degree. Screams in my soul, but I be's what I'm told. And I'm wishing they love me the way they love their gold. Love their gold. Love their gold. Love me. Love me like I'm made like you. Just love me. That's all I ever wanted from you. Love, 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 love. Work, yeah, slay. You are too gay. Better size my big D, but I'm too brown for your party. Work, yeah, slay. You are too gay. Better size my big D, but I'm too brown for your party. Love me. Love me like I'm made like you. Just love me. Love me like I'm made like you. Work, yeah, slay. 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 Work. Thank you guys so much. I'm Honey Davenport from RuPaul's Drag Race Season 11, but more importantly from New York City. And it's such an honor to perform for y'all tonight. Thanks.
Thanks, honey. Good to see you, sis.
Thank you.
So good to see you. Mwah. Oh my gosh, it was so good. You look phenomenal.
Thank you.
Oh yeah, this amazing.
Oh, thanks. You're so sweet. I'm so honored to be here. Thank you so much for having me. This is truly an honor. Thank you.
I loved it. When you went out and thank you, love you, love you. Love it.
Well, it's all about sharing love and spreading love. So thank you so much for allowing me to share and spread some love with y'all tonight. And I hope that people keep donating and keep sharing and spreading love because that's what we're here for.
That's right. And it seems to be working.
Yes. All right. I'll see y'all soon.
Thank you, honey.
Bye.
Love you.
Bye.
I love Honey Davenport so much. It was so beautiful, and we are almost to our goal. So please keep donating. Please keep texting 243-725 and text Allies Ball to that number. It's at the bottom of your screen. 243-725. We are so close to our $5,000 goal. I want to give a big shout out to all of our performers tonight, and a very special thank you to both of you, Natalie and Miracle. Thank you, you beautiful, wonderful humans, for showing up, enjoying the work, and being out there of service to others. And thank you, Allies, for a wonderful Allies Ball.
This was so much fun. I'm so glad we got to do this and be a part of something so positive and so supportive of people in our community. And oh, look, Marty, see, when you were talking, we got, I think, almost an extra $100. So we're on to something here. This
We're
is good.
on to something. Thank you, Malcolm, for your donation. Thank you, John, Noah, Ari, and Zay. Thank you all for your contributions. Keep donating, and we are now at our final performance of the night. Can we raise $1,000 during this performance?
I think so, because
I know we can.
Whoever is like amazing, like needs no introduction.
Not at all.
Like, fabulous. Marty, you want to take it away?
All right. Thank you all so much.
You gave that little hair flip. I know it's going to be good.
Yes. I had to get that wig off my back. I am so grateful. Thank you to both of you for being awesome co-hosts. And please donate. Please donate. One more time, text Allies Ball to 243-725. This is the final number. So get the coins in there now. Here we go. Hit it.
No matter how hard I try, you keep pushing me aside. I can't be through. There's no talking new. There's no time to move on. I need love to feel strong. 'Cause after all you said and done, you're gonna be the only one. Oh, do you believe in life after life? I could feel something inside of me say, I really don't think you're strong enough. Do you believe in life after love? I can feel something inside of me say, I really don't think you're strong enough. And I know that I'll get through this, 'cause I know that I am strong. I don't need you anymore. 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 'Cause I'm strong enough to live without you. Strong enough. Well, I quit trying long enough. But I'm strong enough to know you got to go. If I could turn back time, if I could find a way, I'd take back those words that hurt you, and you'd say, if I could reach the stars, I'd give them all to you. And you love me like you used to do. All right, everybody, text Allies Ball to 243-725 right now and donate. Dark lady laughed and danced and lit the candles one by one. Boom! Danced to her gypsy music till her brew was done. Dark lady played black magic till the clock struck on the 12. She told me more about me than I knew myself. Dark lady played black magic lit the candles one by one. Danced to her gypsy music till her brew was done. Dark lady played black magic till the clock struck on the 12. She told me more about me than I knew myself. Text Allies Ball to 243-725. Allies Ball to 243-725. Donate right now. Get 5 friends to donate. Thank you to my husband Blake for playing piano. Be safe. Wear a mask. Spread love. Donate to Allies Ball. Take the census. Register to vote. Get to the polls and save democracy. I love you all, and I'm so grateful for this wonderful evening. Good night.
No, she ain't. No, she ain't. She ain't. No, she ain't. She ain't. She ain't. No, she ain't. No, she ain't. No, she ain't. She ain't. No, she ain't. She ain't. You better work, bitch. No, she ain't. No, she ain't. You better work, bitch. No, she ain't. She ain't fucking around. 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 You better work, bitch. 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 want me. You want it when you saw me. I like how you look, baby. Call me, call me. 1, 2, 3, 4, let me scream if you want some more. Like push it, watch me work it. I'm perfect. 1, 2, 3, 4, let me scream if you want some more. Like push it, watch me work it. I'm perfect, I'm perfect. Check it out now. To you at home. Just look, the lips, the hips, the taste, the hair, the eye, the skin, the weight. You see what I can do on this microphone. So guess what I'm gonna do to you at home. Perfection. I'm all good already, so moved on, it's scary. I'm not where you left me at all. So, if you don't wanna see me dancing with somebody, if you wanna believe that anything could stop me, don't show up, don't come out, don't start caring about me now.
She might start talking though. You should put her on. Why not? Is she older or younger? Am I still on?
Let me tell you what love is. It's when you meet each other halfway. I'm en route. Emancipate yourself, 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 emancipate yourself. Look in your own mirror and know who you are. Live your life accordingly, the truth is on your own.
I mean, I could just keep being different people. I could be Billy Porter. Should I do like Billy Porter?
Be just who you are, make no apologies. But when it's said and done, who's really sorry? You're okay, baby. It's okay, baby. Emancipate yourself, 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 emancipate yourself. Better be a better you each chance you get. We're all human and fall short of nothing, so forget. It's up to you, baby. Give 'em you, baby. Life's too short to waste your time to what you love. Don't be a sheep, it's better have peace, fly like a dove. Give 'em you, baby. Give 'em room, baby. Like the phoenix from the ashes, or someone
Right, go for it.
distance. I'll try again, I'll try again, I'll try again, we'll try again. Like the
Pretty fun that you brought people in.
sunrise up in the distance. I'll try again, I'll try again, I'll try again, we'll try again. Emancipate yourself, 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 emancipate yourself. You keep on giving me the hold up. You know I wish you'd make your mind up. 'Cause when we getting on it so, you used to be my Romeo. 'Cause you seem like that I have had enough of keeping quiet about all this stuff. You're neurotic like a yo-yo. You used to be my Romeo. You keep on living in the border. You know I wish you make your mind up. 'Cause when you get it on, it's so you used to be my Romeo, Romeo. 'Cause you see the deal, I have had enough of keeping quiet about all this stuff. You're on your right to go like a yo-yo. Oh, you used to be my Romeo. Let it all go. Let it all go. Let it all go. Let it all go. 'Cause you left me laying there with a broken heart. Staring through a disco ball, alone in the dark. And I miss the warmth in the morning, and the nights when I can't stop yawning. With the tears on the pillow and drop my tears. Gonna let it all go from the have no fear. Let it all go. Let it all go. You used to be my Romeo. There are times when I look above and beyond. There are times when I feel your love around me, baby. I'll never forget my baby. When I feel that I don't belong, draw me straight from the words when you said, hey, confident. Excuse my ego, can't go incognito. Every time you see me, it's like winning big in Reno. Don't fuck with me, ho, take you down like judo. Make it rain and taking me from London to Meguro. Well, God, it's okay. You should never be ashamed to have it all. It's gonna be okay. Yeah, you've come a long way. Come take our song. Like the boys, like the boys. Come take our song. I'm so confident. Come take our song. Like the boys, like the boys. Come take our song. I'm so confident. Hot like a fever, make you a believer. Write my name up in the sky from Paris to Shibuya. New Prada, new glove, for the show lost Nicola. Elevate your vision when you put me on the cover. Comme des garçons. Like the boys, like the boys. Comme des garçons. I'm so confident.
the goal.